Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of focus are in weight management, preventative medicine, and holistic health. I would like to introduce you to Dr. Sharon Shirley. Welcome, Dr. Shirley, to the program. We're happy to have you here.
Thank you, Allie. Thanks for having me.
Thank you. Yes. So Dr. Shirley is board certified in family practice. She also has an additional board certification in holistic integrative medicine. She's been in practice for more than 17 years, and she believes that all patients, with the help of an experienced medical provider, have an inner ability to heal themselves. So thank you again for being here with us. Today we will be discussing mental health. And tell us, Dr. Shirley, what are the most common conditions affecting our mental health these days?
So anxiety and depression are by far the most common conditions affecting Americans these days. You know, there are varying degrees of the conditions, and often the two can go hand in hand. So, you know, someone who's very anxious and worrying all the time or has generalized anxiety disorder can also feel depressed and down at times because the worrying really gets to them. Okay. And, you know, someone who's very depressed can also have times where they're, you know, very worried or even panicky, have problems sleeping at times.
So you mentioned there's varying conditions. What causes those conditions?
So the cause isn't known. We know that, you know, environment and genetics play a factor in developing anxiety and depression. Okay. So in terms of genetics, if there's, you know, a family history, then you have an increased risk. There are certain genes that we look at. One of the big ones today that's kind of a hot topic is something called the MTHFR genetic defect.
Okay, so what is that?
So it's a genetic defect in the way the person metabolizes B vitamins and gets rid of different toxins in their environment. And, you know, they may need increased levels of certain B vitamins that are already metabolized. And if they don't get those vitamins, then they can develop anxiety and depression.
Okay, I see. So how are those conditions diagnosed? Is there a test that's done to read that MTHFR that you mentioned there?
There is a, you know, a blood test or saliva test to test for the MTHFR. So that is one test that you can do to look for anxiety and depression.
Okay.
And then the other factor that you asked about is, environment. And one of the biggest environmental factors that can lead to anxiety and depression is stress. If someone identifies themselves as, you know, being stressed or being under a lot of stress, then that alone gives them an increased risk of having or developing anxiety and depression.
Okay. And if they're going through that, so then, or is there treatment that's available for them for that stress that is causing the either anxiety or depression?
Yeah, so there are definitely like traditional treatments, and then there are, you know, more complementary alternative medicine treatments. So, you know, when they see the doctor and they come in, the doctor will kind of ask them questions. Sometimes patients will come in and say that they're actually depressed. Okay. There are questionnaires that can kind of aid in getting that diagnosis, but oftentimes it's not as important to get the right diagnosis as it is to kind of treat the symptoms that the patient's having. So, you know, there are the more traditional treatments.
Okay. So, right, so if you're mentioning there's traditional treatments, what are the alternative, if there are any alternative treatments that someone might have?
So, you know, if we compare them, if we look at the traditional treatments, there's cognitive behavioral therapy or talk therapy. Someone can see a clinical psychologist or social worker. They could also just talk to like a counselor at church or someone in their community, and that would be like a traditional treatment. A complementary treatment that could be similar to that would be meditation or prayer.
And is this something that you would discuss with your patients if they come in? You would recommend them to a specialist or refer them to them that they could easily make, you know, time with them?
So a lot of times we will refer. A lot of the insurances will cover you know, counseling these days. Some of the ones through the churches can be free through the community.
That's a great tip, yeah.
And then, you know, we can also refer them to different websites, different ways to learn meditation, different books that they can do. So a lot of it depends on what they've tried in the past. And,
Okay. And then you mentioned also the treatments that are done. So there's medication that's involved there too, if the patient requires that?
So it can get to the point where someone needs medication or wants medication, rather than some people don't want to invest the time into the therapy, and they feel like their symptoms are far enough along that they need and require medication.
Okay.
Some of the traditional medications like serotonin reuptake inhibitors, such as Prozac, is an example of that.
Okay.
It increases levels of a chemical in the brain called serotonin that will calm someone down and make them feel happy. There's various other medications that affect other chemicals in the brain too, and those are the prescription medications that are out there these days.
So what about for anxiety or panic attacks?
So, and then for anxiety, there are also prescription medications out there. For example, there's benzodiazepines. There's a prescription called Buspar that works in a very different way that can help with anxiety by changing levels of the chemicals in the brain. Some of the medicines that we use for depression, we can also use for anxiety too, and there's some overlap there. And those are the traditional prescription medications.
Okay, I see. And then for alternative medications, if there's not a prescription medication, is there something else that's similar to that would have the same benefits? Maybe something that's over the counter that would help anyone that's looking to not have a prescription?
Yeah, so some of the alternative medicines are very similar to the prescription medicines, and some of them are very different. Mm-hmm. If we want to look at examples in terms of depression of an herbal medication that's similar to the prescription medicines, there's something called St. John's wort, and it's an herb that's been out for a long time that you can get over the counter.
Okay, great. So yeah, that makes it a little bit easier for someone maybe who, of course, I'm sure you would recommend for them to see you first or see their healthcare provider first, but that's an option for them to do, maybe as a start if they happen to see it over the counter.
Yeah, it's always important, if you think you have underlying anxiety, depression, to see your healthcare provider. There could be underlying medical conditions causing it, and so vitamin deficiencies, and you should have, basic physical blood work. You should talk to them about how it's affecting your life, what treatments you've tried in the past, whether it's over-the-counter or prescription-wise. With the over-the-counter medicines, so like I said, St. John's wort can be very similar to the SSRIs. We don't know exactly how it works, but we think it increases serotonin in the brain and increases some of the levels of the other chemicals in the brain that the prescription medicines were similar to. But because it is over the counter, there are various forms of it. You can get it in anything from like a tea to a capsule with the leaves crushed up. Great. There's even an oil form of it, which interestingly enough, if you put on your skin, can help heal wounds.
Oh, wow. Okay. And so that oil form, is that something that would just be applied onto the skin, or how would that?
Yeah, it's applied onto the skin, and it helps.
It may have the same benefits.
And it's been shown to help heal wounds, which you wouldn't, necessarily do with a prescription medicine. So it definitely has,
extra
various
benefits
too.
Extra
benefits.
Yeah, that's great. And so for the additionally to those over-the-counter things, of course, you mentioned if someone does want an over-the-counter treatment, they should be seeing a healthcare provider. But if I were a patient, in the pharmacy and I'm looking to get something, what else might you recommend other than those things, or was that the most that you would suggest?
No, there is a variety of things over the counter. There's anything from vitamins, fish oil has been helped to shown with anxiety and depression. There's many herbal things over the counter. So there's you can just Google it and you can find many things. It's just important when you're looking at things over the counter to realize that they're not FDA approved. So you can have varying doses of it, even within the same bottle. The strength of the capsule could be different.
Okay.
Since they're not regulated by the FDA, you should see your doctor and talk to them about which ones have been tested, because there are other companies that will regulate or test over-the-counter supplements. They can have various toxins in them, and so you just want to be careful to pick the right brand. And
just make sure they're safe, and check with your doctor is probably, of course, the best thing to do first, and let them know.
Exactly.
Okay.
Yeah.
And so how about, tell us about any lifestyle modifications that someone could do that's, has anxiety or depression. Are there options for them as well?
Yeah, so there's multiple like lifestyle modifications that work.
Okay.
Exercise is a big one. Exercise has been shown to increase levels of serotonin, norepinephrine, and dopamine in the brain, and those are the same chemicals that the medications work on.
Okay.
And so exercise itself could treat low-grade anxiety and depression.
Okay. Of course, that's always a little bit hard if you're not feeling so well. Be like, oh, let me go to the gym.
Right.
But that's a great recommendation to know that if you do that, you're going to obviously help yourself to hopefully start feeling better.
Right, and it's important to look at other things too. So if somebody is depressed and they have adrenal fatigue, you don't want them to go out and just exercise 30 minutes 3 times a week right away. You want them to kind of gradually like ease themselves into it.
Okay.
But exercise is one thing that someone, if they've been exercising or if they've exercised in the past and they are healthy enough to exercise, can help with anxiety and depression.
Okay, and then on with going forward with those lifestyle modifications, how about food and diet? Any modifications that could be done to assist with that as well?
So food and diet are very important for multiple reasons. Like we talked about, there could be underlying vitamin deficiencies. We don't all absorb vitamins from our diet the same way. We don't all metabolize them the same way. And if we aren't getting the proper vitamins in our diet, we may need to supplement with that vitamin. And diet also can be important if our immune system is reacting to something in our diet. And the immune system is essentially attacking our body. We can feel bad overall, and then that can affect our mood too, and cause anxiety and depression.
Okay.
So,
Are there any types of foods that you know of that actually make a difference or that can help? Like you mentioned the oil that you can do and that helps, but is there anything in your diet that you can
actually
have?
Cashew nuts have been shown to calm people. It can increase levels of chemicals in the brain like tryptophan and serotonin, and so just eating cashew nuts can be helpful.
Okay.
Like we talked about, getting a lot of good omega-3s, whether it's from fish or canola oil, can help improve mood.
Okay, so great. Those are great options. Even just to have on hand, maybe just at work or something if you're not feeling so good.
Yeah.
Have a few cashews.
There's even spices that will help calm you down, like turmeric or curcumin.
Okay.
There's certain spices that can help you sleep, so just cooking with those spices in your dinner
will help with the sleep. Okay, and then speaking of that, sleep. What type of modifications are needed there if a patient is having anxiety and depression?
So if they have underlying anxiety, depression, their sleep can be affected, and it's important to, when you're treating it, to also treat the sleep issue. Not only is it important to get the right amount of sleep, but they need to be getting good quality sleep. They need to be dreaming properly. All of that is needed to help mood and help how you function during the day.
Okay, and so what's your recommendation on hours of sleep every night? Everybody
needs different amounts of sleep, and so everybody's different, so you can't just make one recommendation for everybody.
Okay.
But one thing I can say that's a big problem and causes a lot of sleeping issues these days is the blue lights from the TV and the computer, and so it's important to have 1 or 2 hours at the end of the day where you're turning off the TV and the computers and the iPads and doing something calming, and actually just having them in the room with you can affect sleep, and so it's important to kind of get them out of the room and have a nice calm peaceful atmosphere where you can sleep and rest and recharge your batteries.
Right, just have a good start to your evening then. Okay, and add maybe the turmeric to your dinner, add the oil on your skin, and you'll be good. So thank you so much, Dr. Shirley. You've really given us a lot of great tips today. And obviously anxiety and depression are issues that if someone is dealing with this, they should see a doctor or their doctor, or come and see you to make sure that it's a condition that they get treated, and that they're not just letting it, letting those problems increase. So thank you so much.
You're welcome.
And thank you for being here with us today. This is Virginia Medical Updates. My name is Alejandra Gonsalves, and we have been sponsored by Virginia Family Medicine.